Hello, I'm Shane Plymell. I'm CEO for Shannon. I'm actually here with Dr. Chris Barnett, our Chief Medical Officer for Shannon, and we're here to visit about COVID-19. Since July 1st, we've seen an increase in admissions, and can you tell us how many admissions we've seen in terms of COVID-19 as their primary diagnosis since July 1st?
Yes, Shane, you're right. We have seen an increase in admissions. We've had just over 30 patients admitted since July 1st. And of those 30, over 80% have been unvaccinated.
When you look at the age ranges, what are those in terms of age ranges that we're seeing in terms of COVID-19 admissions?
Well, the group as a whole ranges in age from 12 to 80, but as somewhat different than on previous COVID surges, this is a younger group overall, with the majority of patients under age 60.
When you look at the Delta variant, we've heard a lot of discussion around that variant lately. Can you expand on the Delta variant and how it's related to Tom Green County?
Sure. The Delta variant is the latest mutation, so to speak, of the virus, and it now comprises 87% of all the cases in the United States, and we assume that it's somewhat similar here in Tom Green County. What we know about the Delta variant is that it appears to be more contagious. We're not sure at this time if it's more deadly or not, but it definitely is transmitted from patient to patient very easily, especially as compared to the previous COVID outbreaks.
And I think we're still looking at the information. And of course, the information changes daily, but I think if you look at the tests that have been positive since basically early July, basically around 15% of those that have tested positive actually have been vaccinated in the past. But the thing about if you've been vaccinated, the symptoms associated with COVID-19 are less. Is that a correct statement?
Yes, that's very true. We are seeing some vaccinated patients who have COVID or testing positive for COVID, and they're either asymptomatic or mildly ill, and they don't seem to get near as sick as their unvaccinated patients.
Really, the key to stop the spread is vaccinations, don't you agree? Definitely.
If there's one thing we can do to stop this pandemic, it's to get vaccinated.
I know from my perspective, my why for being vaccinated is my family, my wife, my two boys, and then also my work family and the patients and families that come to Shannon, and just also my mother-in-law is just recently re-diagnosed with cancer, and I think just to make sure I'm protecting her, that it's key that I'm vaccinated as well as my family. And my wife is actually going back to work as a second grade teacher, so I would hate the fact that if I didn't get vaccinated that I'd bring something home and then she would in turn would take that to her classroom, because what's key here is those under 12 cannot get the vaccine right now, so we need to protect our youngest people in our community.
Right. And as for myself, I have young grandkids who are about to start back to school, so I definitely want to protect them. I also work in a nursing home where there are vulnerable elderly patients that we want to do everything we can to protect them. So being vaccinated is very important in that environment.
So if you want to get vaccinated, please come to our Shannon South campus. We're running our vaccination clinic Monday through Friday, 7 to 4. But on Tuesdays, we do extended hours, so we start at 7, end at 7. You don't need an appointment, so please come see us and we'll get you vaccinated.